Good evening to you and welcome to iMed. On iMed today, our topic would be migraines, and we have with us consultant neurologist Dr. M.T.M. Rifsi to educate us on this topic. A very good evening to you, doctor, and welcome to the program.
Yeah.
And doctor, first and foremost, just to the layman out there, what is a migraine? What do you consider as a migraine? Because we have headaches, migraines.
Yeah, migraine is one type of headache. It's much commoner. And migraine is causing a lot of serious, that means severe headaches. And sometimes somebody can feel that they are getting a thunderstorm-like feeling. But migraines usually, they have a history. That means they had several attacks before. And usually this starts in the younger age groups. We'll say just above 15 is commoner. By above 50 is lesser. And migraine is episodic. That means you can get time to time.
Okay, so this is not a continuous
It's not a continuous headache. Other thing is, once you get a headache, this headache can last for a few hours, even 3-4 hours, or sometimes that go into 3 days, 72 hours.
That's like continuously without a break.
Yeah. So, only thing, migraine is a type of headache where it's not serious. But everybody who has a headache, they are really worried. It's getting several times. Why? It's not getting better, and sometimes they are devastated and they are unable to go for their employment, and their day-to-day activities are getting almost halt. And other thing is, they are always worried there's something going wrong inside the brain.
So are you referring to headaches which doesn't go away for painkillers?
Yes, this migraine, if you take the pain medicines, that means the paracetamol, aspirin and so on, if you take it at the correct time, it will respond. So that means the migraine sufferers, now one of the migraine usually starts on one side of the head. We'll say on the front or in the back of the head, but same time you can have a pain in the eye and behind the eye. That's how the storm starts. But sometimes lot of people, they have a aura. Lot of means percentage of people, they can have aura. Aura means there are premonitory symptoms
before you get a migraine.
Attack. So that sometimes the blurring of vision, and then tingling on the face or arm or leg.
Why do you refer to this as a migraine attack?
Migraine attack means now this comes with a severe headache, no? So before that you get the aura. If you know, identify the aura, if you take some treatment at that point, you might not go with the full-blown migraine headache. Therefore, if you have any premonitory symptoms, some people feel energetic, some people are yawning, some people are a little depressed, sometimes you can have a stiff neck, blurring of vision. All these things might lead into migraine. A sufferer who has migraine, they know, now if I am getting this, next is I am going to get the headache. So during this period, the prodrome or whatever the next is the aura, you can take some medications prescribed by the doctors. Self-medication we always discourage, but when the doctor says you take this during the episode, you can continue. So by taking those medicines, sometimes you can, mostly, you can prevent the big attack.
Can there be any false alarms as well, doctor, for the aura?
False alarm, what do you mean by that?
Meaning like if it could be like a normal occurring like once in a way, maybe blurring of vision or something
but only
like
thing, one thing we have to mention, if anybody who has a headache, which is not going down with all these medications, if they have a fever, some sort of neck stiffness, the stiff neck, and if you have focal symptoms, one side is weak, and they have a severe headache, vomiting, early morning headache, sometimes it may not be migraine. So there may be some red flags, right? So all the headaches are not migraine. So there can be internal things. That means it may be very rarely a tumor or a bleed or some sort of a stroke. Though therefore you have to be careful. But a migraine sufferer usually knows that he has a history. But if anybody gets the first attack, above 50 years headache, first attack, not the person who had at 20 now getting at 50. If anybody is above 50 and getting their first attack, I think they should consult a doctor or a neurologist to see whether this is some sort of migraine or a tension type headache or something sinister inside the brain.
And doctor, are there any types of migraines?
Yeah, there are several types. There are classical migraine and common migraine. The classical one is rare, common one is common, right? So what is classical? You get all the features. You have a prodrome, you have a aura, you have the attack, that means the headache phase. Thereafter you are in the recovery phase. All those will be there in the classical migraine. But less people get the classical things. But one thing you have to remember, if you your aura getting some sort of flashes of lights, almost like lightning type of things. So that is we are going to a classical migraine. But some people won't have that. They'll straight away get the headache.
They'll just feel the pain.
They'll get the headache. Yeah.
So those are the types of migraine, classical and also the common one.
Common migraine. So but there are one bacillus migraines. There are so many things, but these two are commoner.
And doctor, you said that there is an episode when somebody gets a migraine attack. It comes in episodes.
Yeah.
So what's the gap like?
Yeah. So usually there are trigger factors who can get an attack. That means, especially now we'll say sleep deprivation. You are going beyond 12 midnight. You are sleeping less than 6 hours a day. You have been stressed. Okay, and there are people who are taking alcohol, wine especially, and certain foods. And certain food additives like MSG, monosodium glutamate, that means like there are preparations like enhancing the food, the colors and tasty things, and even perfumes.
Perfume?
Yeah, certain people can't tolerate perfume. If somebody has perfume, very bad smell, they might get a trigger a migraine. Other thing is fasting. If you are delaying your meals, you will get more problems. And if you are well hydrated, your chance of a migraine fellow person getting a attack is much less. So you'll be well hydrated, well fed, don't fast, sleep at the correct time. Those are very important.
How to avoid? By changing the lifestyle, is it, doctor?
Yeah, lifestyle means you have to be a relaxed person, right? Other thing is, once I said lack of sleep, but oversleeping also can induce migraine.
Everything should be done
moderation.
In moderation.
Moderation, yeah.
So tell us a little bit about the lifestyle changes which could help a person from avoiding a migraine attack or triggers maybe.
One thing before going to that, the migraine is much common in ladies, women. When you take it, may be 3 to 5 times commoner than a male. So therefore, why it is, there are reasons. One is hormones, estrogens. So whenever in a female person's body, if the estrogen has imbalance, that means just before menstruation, during menstruation, or even during menopause, these changes can induce a headache. So therefore, the females are more prone to have migraines.
And doctor, about the lifestyle changes, can we elaborate on that?
Yeah, lifestyle means you can work, but you need relax period. That means don't work 7 days a week. At least 5.5 days. Then you have some relaxation, sleeping well, don't deprive your sleep, and certain foods you can avoid. But only thing, food and migraine, very important thing like lifestyle. We can't give a list of food that don't eat, right? There's a big list, cheese from wine and all those things. But chocolates, everything comes in play. Everybody is worried about this chocolate. But only thing is, if a person who has migraine, once you take certain food, which is iced coffee or a food or a chocolate or whatever, if you get attacks, you can stop it. But you can't stop everything in one person. So you have to individualize. Certain things he will say, I can't take. Then he won't take. Like that. Other thing is your lifestyle should be much happier. Don't get depressed. Don't overwork also. If your workplace is very lot of that means you're very anxious and too much of work and you are very stressed, then more migraine attacks can come.
And doctor, you did mention that female are more prone to getting migraines. Is there like a specific age when people start getting migraines?
Yeah.
And I think people,
usually those days we say about 12 years and all. Now we see even 8-9 years children also getting headache. That may be mostly these exams, too much of classes, they don't have time to play. And
also screen time, can that also?
Screen time, and they are on the online classes, especially they are using cellular phones and small screen, white light, all those things can induce a headache.
Right. Yeah. So now it's even seen on 8-year-olds. So there's
even those fellows are telling, because these children, After the 3rd grade, that means from 8 years onward, they are going for so many classes. Moment the normal school is over at 1:30 or 1 o'clock, they are going straight to a class, or they come home and go. So they don't have a playful time, they are not meeting their friends. Educational activities are fully loaded.
Exactly.
So a child also, you should give some relaxation time. So rather than be on the screen and playing games and all those things, better to be with the children and play outdoor. That's much better.
And doctor, now you did mention that if an individual is above the age of 50 and they suddenly get the first attack of a severe headache or migraine, they need to go and check themselves for further evaluation, because it could be something else.
Yes.
So sometimes people misunderstand, or they always think whenever they get a headache it's a migraine. But what are the what are the main concerns they should be worried about to differentiate between a migraine and
a serious problem? Yeah. Now, if you get a thunderclap headache, now we call it thunderclap in our terms, is you are getting like a lightning speed. Usually migraine take time to pick up. Migraine don't come like that. It starts slowly and just within about 1 or 2 hours it will come to the peak. Right. If you get something suddenly happening like that, like a thunder, it may not be migraine. It may be something going very serious inside the brain. It may be a bleed. Next thing is you are having a headache happening every day for some time, almost daily headache, early morning headache, vomiting, and you are getting focal symptoms. Focal means you are getting symptoms on one side of the body. That means you are getting a weakness of the arm, leg, or the face, speech problems. Anybody has headache with fever, neck pain, neck stiffness, those are red flags. That means they should meet the doctor or a relevant consultant to verify whether they are having a problem or not. When you go to the doctor, they usually investigate them. Sometimes they may end up in a CT scan or MRI brain, depending on the necessity. All these are important.
So that also could be any age?
Any age.
Any age.
Even you are maybe 20, 30 or 40, doesn't matter. What I have mentioned, you have to be very careful
about it. So that is like stiffness of the neck.
But on the other hand, somebody asked me, now migraine sufferers, we do a lot of brain scans, because the one thing is there are symptoms, other thing is patient's concern. They will say, my parent had this problem, can I have this? So therefore a lot of scans were done, but most of the scans are normal, but it's reassuring the patient at the same time, and we know there's no big problem inside the brain. These are things will depend, but all the migraine sufferers doesn't need a brain scan. What they need is careful evaluation of the history, change the lifestyle, and don't do all the risk factors should be minimized, and take medicine whenever. But there are migraine sufferers, they get once in 6 months, 1 or 2 attacks a year. So they don't need continuous medication. They can use certain medicines which can be used during the attack. But there are patients, they are getting 3, 4, 5 attacks a month, and they are not going for work for 3, 4 days. That means this is a real issue in migraine.
That's serious, because it's disrupting their daily routine.
The work as well as their normal activities at home, looking after the children, all these things. Therefore, those people who are getting more frequent attacks, we can give medication to minimize the attacks. So they are called migraine prophylaxis treatment. There are many medications a doctor can prescribe, from simple things to further advancement of medication, and they will do well. That means if you are getting 5 attacks a month, we can minimize that. So that will increase the workload. That means the workplace will be well balanced. At the same time, our country, we are not calculating. There are Western countries, they will calculate. They will say, because of the migraine, we are losing so many billions a year because the migraine sufferers are not coming for work.
They don't report to work because of the pain.
So therefore, migraine should be treated. Migraine should be analyzed, diagnosed, and treated.
And doctor, does a patient who's suffering migraine, I mean, like you just explained, where it disrupts their daily routine, and you told that they need to take medication, for how long do they have to consume medicine?
There is no precise period. But only thing, once we start this prophylaxis, that means we are going to prevent the further attacks, usually we give for 6 months to 1 year. Usually we give 6 months, if they are better we stop it and wait and see. If necessary we can continue. but it's not a lifelong treatment.
Right.
But a lot of people, when they adjust to the lifestyles, they are, whatever I have mentioned, and taking certain medications, they can have a good life. Only thing, there can be a family history in migraine. If your mother has migraine,
So
the
this is
daughter has high
genetic.
chance of getting it.
So this is genetic as
Genetical association is there always. But
Right.
not all. Some people they have.
well. Right.
So not even the mother, sometimes the mother's sister can have it. There's some close family member can have migraine in a lot of people.
And doctor, you mentioned that they don't have to consume medicine for a lifetime, but do these pills have a side effect on the people who
Yes.
get migraines?
Now, once we order these medications, so especially the pain medicine, during the attack, some people misuse it. For example, if you are taking paracetamol, you can take, an adult can take 2 tablets 3 times a day only. Sometimes they take not 2, 4 at a time. And they combine with medications. So when you use overuse of pain medicine, we call this medicine overuse headache, MOH. Medicine overuse headache. That happens in a lot of people. When they are using the pain medication a lot, sometimes you can have headaches which can go up to even 15 days, 30 days like that. Medicine overuse headache. So therefore, use the medicine but be careful and don't overuse it.
And doctor, can a person who gets migraine regularly, end up getting any other disease, or will it lead to anything?
Usually not. If your diagnosis is correct with migraine, not. But if you are having other risk factors, we'll say you are a diabetic, you are having hypertension, high blood pressure, you have cholesterol, those things can lead to certain matters. But migraine itself, very, very rarely, a migraine person can have a stroke. That preponderance is there. That chance is little high when you're taking a normal population. But migraine per se is not a serious thing. But if you have underlying thing only, you have to be careful.
Can it also go along with vertigo?
Yes. Now, vertigo is a different entity totally. But migraine sufferers can have dizziness, imbalance, but nausea, vomiting, all these are common symptoms.
Right. So which means if the person is they could even misunderstand a migraine for vertigo.
Sometimes, but only thing, vertigo itself per se won't cause headache. Their symptoms are more
into
swinging
dizziness.
and turbulence and imbalance, nausea, vomiting, sweating. Those are more common with vertigo. But if you have association of headache, then of course you have to think about that.
Right.
But vertigo itself won't cause headache.
And doctor, now you did mention that the person who has migraine regularly needs to consult a doctor, but when do they actually have to come to a doctor? Is it like during the first attack, or if they feel an aura?
Usually what we mention is if you have an attack, at least 1 or 2 happening, better to go and consult even your family doctor who is there near your house. You can go and discuss it, whether what is it. And if he thinks there are some red flags and sinister features, then he'll refer to a consultant or a hospital to investigate. But therefore, at least we are getting 1 or 2 attacks. Better go and discuss that with your doctor. That's very helpful, and it will reassuring, and you know what you have.
Exactly.
Yeah.
And doctor, we've come towards the latter part of the program as well. So treatment, as you mentioned, is of course medication.
Yeah, there are several treatment ways.
Right.
One
Can
is,
you also talk about the types of
other thing
treatment
is
available?
already I have mentioned the trigger factors.
Yes.
All these things: smoking, alcohol, lack of rest, sleep at the correct time, 6 to 7 hours sleep a day, regular meals, all these better do that.
So that's a message going
is
out.
best treatment is that. The next thing is be work in a stress-free environment. Hydrate yourself well, feed yourself well, right? Then if necessary you take medication whenever necessary. But if you are getting too many attacks, you can go to a doctor. Doctor and take some consult with a neurologist. Maybe you can go to him and discuss the issue, and investigations are necessary he will do, and he will advise you to take medication like that.
So most often the common triggers, as you mentioned, could be stress and also having a family history.
Yeah, even flash of light like this can induce a migraine. Some change in the temperature can induce that. There are so many factors which can induce a migraine.
Anything could lead
Sometimes
to a
sound.
migraine.
Too many sound around you. You can't tolerate that.
So it differs from person to person.
But you can't put everything in one bag. So individual, he will say, I can hear even a loudspeaker, but I can't see the light.
Exactly.
It depends.
So we need to understand that part. It's about trying to figure out what makes you very uncomfortable.
That's it. You actual time to come, you can maintain a diary. The time of the day, the time, what are the factors which are precipitated. So by going through 1 year record, even the doctor will also benefit. This is happening on these days, during menstruation, just before the menstruation, this after the night duty. So you can find the trigger.
Right. So we've also given a message to the general public out there, because
maintain a diary.
Maintain a diary, maintain a note. You have a smartphone, you can note down everything and your main triggers, because it's vital to get yourself checked, because sometimes we might mistake a migraine to,
some other
illness. We might not, notice that much, but then it could disrupt something important you end up doing as well, right, doctor?
So I think you can ask now, whether a brain tumor has headache. Yes, certainly yes. But only a doctor will investigate and find out whether it's a brain tumor. But all the migraine people doesn't have tumors.
Exactly, doctor. The thing is, the first thing people do right now, what I've noticed mostly, is that when they get some symptom, Google.
Yeah, the Google doctor will say always number one is brain tumor.
Exactly.
That is the problem. So therefore, go to a nearby doctor,
general physician,
GP, discuss. If you have anything, you can go to a consultant.
Okay.
That's it. But don't come to personal diagnosis.
Exactly. So that's an important message to the public out there. It's not just for migraines, but for every other disease.
Any illness.
Illness, you've got to consult a general physician first, and then they will further evaluate. Thank you very much, doctor, for enlightening us on this topic, for educating us on the types of migraine and how a person could end up getting one and what they should do.
Yes.
Thank you very much.
I think this will give some message for them to get better.
Exactly, yes. Thank you very much, doctor,
yeah,
for being a part of the show. Ahmed, have yourself a pleasant evening.
Thank you.
And with that, we wind up our program. Thank you for tuning in. We'll catch up on the next episode of Ahmed. We had with us Dr. MTM Rupavahini. He's a consultant neurologist. Thank you for tuning in. Have a pleasant night.